One of the harder things to deal with is when patients come in and they have multiple complaints that they want to talk about, and we don't have time to address more than a couple of them at a time. So in my practice, I'll ask people to give me the top 3, and we'll get to as much of that as we can. I'll have the others mentioned in the chart, but we don't have the time. So when patients like this come in and they're talking about a problem and they don't feel that their doctor really addressed it with them, I will recommend that they make a separate appointment just to go in and talk with the doctor about that one problem, because then the doctor will have time to focus on that one problem. So even when the patient came in for something else, we did spend a little bit of time talking about that while trimming her nails. So remember, don't go into your doctor with 11 things you want to talk about. They just don't have the time and they can't focus on them. So narrow it down to 1 or 2 and then make another appointment for the others, and you'll feel like you're getting better care. So little pearls of wisdom from Dr. Nail Nipper. Do you know from what?
That's the question. I wish I knew.
Have you had it looked at?
No, I guess several weeks ago, I mentioned they were thinking about, they did x-rays.
Okay, and those?
Arthritis.
They said some arthritis in the knee?
Yes.
Okay. Now, is it painful all the time or only when you're putting weight on it?
When I walk, it sure is hurting.
So every time you put weight on it?
Yes.
Okay. And so when you're in bed at night, do you get pain in it?
No, very little.
Okay, so it's probably not coming from your circulation. And so they took an x-ray. Did they look at your hip?
No, nothing was mentioned about the hip.
Okay. Was there a plan for what's next to try and figure this out?
No, I guess I really didn't. I guess when they tell you it's arthritis,
well,
you figure you go with the pain.
But arthritis doesn't usually come on suddenly and go from 0 to really bad in a few days. So when you were talking with your doctor about it, was that when you were having a visit for something else?
Yes.
Okay.
Yes.
So sometimes when you do that, they don't have time to really give it all the attention that it needs. So sometimes if there's a little crack in the hip, it'll hurt in the leg. Sometimes, it can be a lot of different things. So my recommendation would be that you call and schedule an appointment just to talk about that left leg pain.
Okay.
And ask if, just say, is there a different test that we can do that will, if it is arthritis, will somebody give me a cortisone shot to help it? So I think that it's worth calling when you get home and making a follow-up appointment just to talk about the leg pain.
Okay.
All right?
Okay.
It's hard sometimes when we go see our regular doctors and we've got 11 things we want to talk about.
I understand.
We see it here sometimes too, like somebody will come in for, I dropped something on my toe and I think it might be broken. And we go through the whole appointment, and then as I'm walking out the door, they'll say, well, aren't you going to trim my toenails? And I'm like, no, that wasn't what your appointment was for. I don't have time to do it all.
Mm-hmm.
So we'll have to set up another appointment for that, but yeah, so call when you get home.
Okay.
Because you got to keep moving.
Yes, absolutely. And how's life been treating you?
Life's been fine. I'm, just going along. It's quite a callus here.
In that area, and it's happened before.
Yep. All right, we're just going to trim these off a little bit here. But I'm happy that it's fall. How about you?
Oh, yes. Fall is a very beautiful time of the year. Only it goes too fast.
Well, we've had so little rain this year that, the colors probably aren't going to be spectacular. Right foot. Start doing that. Okay, here we go. Is this hurting? Yeah. Okay. So you got anything fun planned for the upcoming winter?
No, I really haven't.
No dog sled adventures or?
Some of that sounds fun. No, just happy to continue on feeling good.
Good.
Good health is a real blessing that I appreciate.
Yeah. And that's why I think it's worth following up on that leg pain and just seeing what you can do.
And do you happen to have any special plans for the winter?
I actually made reservations to go to Grand Marais up on the North Shore of Lake Superior.
Yes.
I've lived here 30 years. I've never been up there.
Mm-hmm.
And so as an excuse, I signed up for this class. They have a lot of artists up there. So I signed up for a class. I'm going to make mucklucks,
And
which are like snowshoes made out of leather and canvas.
really,
So I figure what better class for a podiatrist to do, huh?
I'd say so too. But that'd be fun and interesting for you.
Yeah, and it'll be in the winter, and I gave myself a couple days to hike and do some photography after, so
Oh, great.
yeah. So I haven't gone anywhere in 2 years.
I can get those on.
No, that's fine. I put the lotion on, I'll do your socks. I'll let you do your shoes. When I put lotion on, I always do your socks because
Yes.
I don't want people slipping on the floor.
You're a good doctor.
No, it's because I don't know how to fix concussions. Thank you for letting us do the video again.